Health Psychology Study, Nicotine Study, Ennet et al., 1994. Aims. The study looked at adolescent smoking in relation to friendship cliques, gathering data about both. To see if peer group pressure is linked to smoking behavior. Procedure. The study took place in the USA using 9th grade students. The data were collected in 1980, but the researchers claimed that smoking rates had not gone down in the USA since the time of the study, so the findings could be generalized to present-day behavior. A self-administered questionnaire was used, and mothers were asked about their own education as well. 1,092 students were used across 5 schools, and 87 friendship cliques were reported. A clique was defined as 3 or more adolescents within the same school who link to most other members of the group with regard to friendships. Friendships between schools were not counted. A link that went one way, e.g. from person A to person B, was assumed to be a two-way friendship, a reciprocal link, but greater weight was placed on actual reciprocal links where both mentioned the friendship. 42.2% of those taking part were clique members, and the others were isolates or liaisons. Liaisons were friends with others but not members of a clique. Method: questionnaire. Results: 87 cliques were found, and that included 461 adolescents, so 42%. 93% of cliques had between 3 and 10 members. The average clique size was 5 members. Members of a clique were generally similar with regard to gender and race. There were very few mixed cliques. 89.8% of all clique members were non-smokers. 68% of cliques were comprised of entirely non-smokers and 2% of entirely smokers. Conclusions: clique members who smoked tended to associate with one another, but there were not many of them. Perhaps peer groups contribute more to not smoking than to smoking. Isolates had the highest level of smoking, which backs this up. Findings also relates to social learning theory as an explanation of substance misuse. Perhaps non-smokers become cliques rather than cliques become non-smokers. Evaluation strengths. Cliques are found from analyzing the data, and then members of cliques themselves say whether they smoke. Shows that the data is valid. There was thorough sampling trying to get all 9th graders using 5 schools, so generalization is possible to a point. Weaknesses. Only 3 best friends were asked about, which might limit the data's validity. Non-reciprocal friendships were accepted as reciprocated, whereas the friendship might not have been real. There may have been social desirability in the responses about non-smoking. Self-report data can be unreliable, and passive smokers may register as smokers in the breathalyzer test.